Hello, everybody. It is Dr. Tony Hampton. As you know, a board-certified family medicine and obesity medicine physician here with a post-podcast discussion. And alongside me is my buddy from Tennessee, is Dr. Ken Berry. And we just recorded the fourth episode of the Protecting the Nest podcast. I'm going to release that episode on July 24th, which is on Friday. So make sure that you get your podcast apps on your phone. Somebody in your family know what a podcast is. And that way you can not only listen to what we're going to discuss today, but you can listen to the actual podcast, which is going to be completely different than what we share here with you today. But I really appreciate you guys who are doing this live. During the podcast, we talked about lies your doctor may have told you based on many of the principles that Dr. Berry shared in his book entitled appropriately, Lies My Doctor Told Me, Medical Myths That Can Harm Your Health. And there's a lot of things you've been told that's not true that's going to harm your health. So we're going to have fun with this. We're going to talk a little bit about it. If you know somebody who needs to hear about the lies they may have been told that's harming their health, share this video with them on Facebook, share it with them on YouTube, subscribe to Dr. Berry's YouTube channel. He has 1 million subscribers. Subscribe to my YouTube channel. I'm following in his footsteps, trying to grow my channel because we want to make sure we reach all of you and help you guys to understand how to get to the root cause of disease. So let me introduce my partner in crime. Dr. Berry is a board-certified family physician. He's also just a guy that's out in Tennessee making it happen. He's really a remarkable doc, has been doing this for over 20 years. And with all those followers, he's teaching that low-carb, keto, and, of course, the carnivore diet. Also talking about intermittent fasting. You know, who eats breakfast these days? It's a waste of time. That's the only people that care about breakfast are the people who work for the food companies, but your body needs to take a rest. So welcome to our post podcast discussion. We're going to continue our discussion, but for those who may not hear the podcast, Dr. Berry, do me a favor and introduce them to who you are. Just give them a brief history of, how we got to know each other and how you became this low carb guru.
So I'm a family physician, been practicing for 20 years. And the first few years of my practice, I became morbidly obese. I weighed 297 pounds. I was pre-diabetic, had a whole host of medical conditions that I had to take medication for. And it was really hard for me to go into a patient's room and proceed to tell them how to lose weight and be healthy when I myself was so unhealthy and so overweight. And so I started this journey of trying to discover what is a proper human diet. What should humans eat? What should they not eat? When should they eat? When should they not eat? And during that process of learning for myself, for a selfish reason, trying to improve my own health, I wound up kind of stumbling onto a bunch of things that other people had been working on, but I kind of discovered them for my own self, applied them to my health, immediately started to lose fat, started to lose inflammation, reversed my prediabetes, reversed my morbid obesity. And now I'm a non-diabetic and I'm not even obese, much less morbidly obese.
Wow.
And I started sharing that with my patients. And then one day my genius wife said, you know what you should do? You should make a YouTube video. And that was about 2.5 years ago. And the first time she said it, I was like, "Oh, what are you talking about? I'm a doctor. I'm board certified. I'm not going to make some stupid YouTube video. That's for teenagers."
That's right.
And she said this to me. She said, "How many people do you see a day?" And I said, "Oh, 30, 40 in the clinic, And she's like, "Well, that's good. You're helping 30 or 40 people a day. You realize on YouTube, you could help thousands of people, right?"
Yeah.
And I had to say the words that every husband dreads having to say. "Honey, you're right." And so I made a YouTube video, and then I made another one. Then I made another one.
That's right.
And every time I would see a patient whose life had changed because they had changed their diet, every time I would read a research study that in the conclusion, they said, this proves so-and-so. And I was like, wait a minute. I read it doesn't prove anything. I would make a YouTube video. Every time U.S. News and World Report would come out and say, Weight Watchers is the best diet in the world. And I would go, wait a minute. Weight Watchers has been around since 1969. If it was ridiculous. The best diet in the world, there wouldn't be no fat people.
Right.
What are you talking about?
That's right.
Right. And so every time I would have one of those aha moments, I would make a YouTube video. That's exactly how I've been doing this. And I hope that I've been able to help people, because that's why Dr. Hampton and I both get up and put our pants on every morning.
That's right.
Because we want to help people have optimal health, not just get by, not just stumble by, limp by. We want you to be optimal. We want you to be almost superhuman.
And there's no reason why you can't do that. And, you know, for those who want to see us talk some more beyond this conversation, Dr. Berry invited me to a live event. So if you just search on YouTube, my name and his, you'll see that. That was a few weeks ago. But I promise you, Dr. Berry, I mentioned this before we came on. My second to last video visit today was a patient who I had never seen. He found me because of you. He's been following you. He got diagnosed with, he's only 40. He got diagnosed with diabetes in January. And his A1C was I think he said it was in the 9 range. A 40-year-old newly diagnosed with diabetes and hypertension, and he had gout, all of that. He learned the principles that you teach about low carb and keto and carnivore. And he did his test a couple of weeks ago. He had him at his previous doctor's lab, and his weight, first of all, went from 208 pounds down to 158 pounds. And that, you know, just in 6 months. He was given metformin, which all doctors put metformin in your mouth right away. And it's not a bad drug in terms of how it works. It does reduce insulin resistance, but diet and lifestyle does it much better.
Yes.
He was on metformin for 1 month and had to take himself off. They said metformin won't lower your sugars, but guess what? In some people it does.
Yep, that's
he
right.
talked to his dietitian. Shout out to the dietitians. But please, dietitian, if you're paying attention to me, if what you're doing is not helping your patients, please hear my plea. His dietitian saw that he had done so well, still insisted that he eats oatmeal every morning. You got to be kidding me. His doctor is still insisting that he goes on a statin, yet his triglycerides went from 193 to 143. So my point is this. I told him, let's not do any of that. Let's measure your markers of inflammation. Let's go in that direction. So I guess the first thing I want to ask you, Doc, because I'm thinking about this patient, this ideal of statins should be in the water. They think metformin should be in the water. Could you please tell the audience why the idea that these drugs should be in the water is a lie? What would you say to that?
Well, if everyone in America eats the standard American diet, we maybe should put metformin in the water.
Right.
Right?
That's right.
But if there is a diet that is delicious and nutritious and sustainable that you can eat, and you get to eat it until you're full. You don't have to portion control. You don't have to calorie restrict. You don't have to starve yourself. You get to eat till you're full. What a concept. If there is such a diet out there like that, and it will reverse your hypertriglyceridemia, make your triglycerides go back to normal. If that diet will reverse your type 2 diabetes, if it will get rid of fatty liver, if it will do all those things, then maybe instead of putting statins and metformin in the water, maybe we should just eat that diet. And I would opine that there is a diet like that. And I refer to it as the proper human diet. It's a low carb, keto, carnivore diet. There's a wide spectrum that you get to choose from in the proper human diet. And when you eat from this diet, it's delicious. You get full. You get to push away from the table and say, "Ooh, I'm stuffed. I couldn't eat another bite." And you also get lower triglycerides, and you get lower levels of blood sugar and insulin, and you get a decreased risk of heart attack and stroke and a decreased risk of cancer. You get a better mental attitude. Your mental health actually improves. Your anxiety, your depression, all that gets better.
Your mental health.
Yeah, it
That's
all gets better
insane.
from eating this diet. It's almost like it's the diet that human beings were meant to eat. It's
Right.
weird, right? Yeah. So instead of putting chemicals from a chemical factory in our water supply to try to control our metabolic health, maybe we should stop eating the diet that caused our metabolic disease, which is the
Root
standard
cause.
American diet.
You get
Just a
into the
thought.
root cause. That just makes sense. But as I think about animals, another myth that I want you to comment on is that, because I'm looking at you, right? And we're going to show an image. If you can just hang in there, audience, we're going to show an image of you with your beautiful daughter before you started your journey. So when I looked at you, I got jealous. I saw your image and you had your arms up, right? And I'm like, what the? But when I grew up, they said you got to drink a lot of milk to get that. So my question is milk, or is, it's an animal. So how important is it that we have milk in our diet if we're adults versus our babies?
Yeah. So why do mammals give their babies milk? Why do they do that? They do that so that their baby will grow and gain weight as quickly as possible. Because in the wild, it's dangerous to be tiny and feeble. So you want to put on the pounds as quickly as you possibly can. That's why mammals give their babies milk. And so I've told patients for 15 years, if you want to gain weight as quickly as you possibly can, drink lots of milk, because that's what milk is made for. Problem is that over 2/3 of human beings on the planet as adults cannot digest milk. They have a reaction either to the lactose, the sugar, or to the inflammatory proteins found in cow's milk. Right? And so cow's milk is for baby cows. That's what it's for. Humans drink milk when they're babies, and preferably they get that from their mother, right?
Yeah.
Or at least another human being, because that's human appropriate milk.
Right.
But when we wean from the breast, we no longer need milk. If we still needed milk, then all humans would continue nursing their entire life, right? And that would just be part of mama's job. She'd have to come to your work and go in the back room and nurse you. But that's not the case. And in fact, most human beings stop being able, they stop having lactase, right? They can't make the enzyme anymore to break down the sugar in milk at about 5 to 10 years old. That's just science. And so the huge multi-million-dollar dairy farms, and when I say farm, don't think about the mom and pop with 2 cows and a dog and a pig. That's not the farm I'm talking about. I'm talking about the factory farm that's got tens of thousands of heads of cattle. They want you to drink lots of milk because that's their bottom line. That's the profit. But drinking milk is not healthy for adult human beings. It serves no purpose other than to make you gain weight and to most likely cause inflammation somewhere in your body. Now, I'm not completely anti-dairy. I think the fat in milk is fine for human beings. I think we can make use of that in the form of cheese, butter, ghee, heavy cream, stuff like that. That's fine, but it's the milk sugar and it's the milk protein. That's the boogers right there that are going to either cause you to get fat or cause you to have inflammation. And so enjoy your butter, enjoy your ghee, enjoy a little bit of heavy cream, but not too much because there's still some protein in that and a little bit of carbohydrate. Enjoy your full fat, real fermented cheese. Those are probably fine for us. But to drink milk, especially skim milk, which I consider to be the breast milk of the devil, don't drink that. That's not good for human beings.
I've been a lot of times when I'm doing something quick, and I'm sure you do this, I'll get some ghee. And I'll take that ghee, and that's a GHEE, and I'll put it in a big, skillet, and I'll throw my steaks on that. And so you're cooking with essentially butter and a steak, and I think that the fancy restaurants do this all the time. They use butter all the time. We just use ghee because they can handle the high temperatures a little bit better. I love it. I'm a steak guy, and I think tonight I may even go in that direction tonight. So you got me fired up. Another thing let's stay in the dairy space for a minute, eggs. So I think I had 4 eggs today, and I can eat anywhere from 3 to 5 eggs easily, maybe more. But people are so afraid of eggs because of the cholesterol.
Yep.
And that's a lie.
Yep,
Oh
it's a big fat lie.
So
Yep.
let's talk about that lie that we've been told.
Sure. So back in the 1950s and 60s, it became a very popular hypothesis that eating saturated fat and eating cholesterol would cause you to have a heart attack or a stroke or a premature death. That was a hypothesis. And the way science works is you have a hypothesis, then you do some research, and you either prove or disprove that hypothesis.
Right.
The problem, the reason, and everybody listening is like, yeah, you know, on Tuesday, eggs are good for you. On Friday, eggs are bad for you. And it just keeps going, who the hell, who knows what they're saying now, right? The reason is that they were using a very pitiful form of research called epidemiology, observational studies, to try to show an association between eating lots of eggs or butter or bacon and an increased risk of heart attack. This is terrible research, first and right off the bat. And that's why they keep having this flip-flop situation, because they'll do a big study and say, oh, it looks like eggs are slightly bad. Avoid eggs. Then they'll do another big study and be like, well, it looks like eggs are slightly good. So eat an egg or two or three a week. Don't eat too many, though, because we don't know. Well, eggs are an ancestral food. We human beings have been eating eggs every single day since we started being a species on this planet. So if you're going to tell me this ancestral food that humans have been eating for at least 250,000 years, they're bad for you, that'd be like telling me that breathing air is bad for me.
It's not logical.
Or that it's like, what? Or drinking water is bad for you. You shouldn't do that. What?
Yeah.
What are you talking about?
It doesn't make any sense.
If you're gonna make an extraordinary claim like that, then you better have some damn good evidence to back it up. And they don't have even good evidence, much less damn good evidence. The evidence is atrocious. So we've always eaten eggs. We always will eat eggs. Eat your eggs. Don't eat more than a dozen at one meal. That's my recommendation.
That's right. I love it. Hey, Keisha Johnson, one of our Facebook followers, she's saying, I eat egg whites. I think you would probably argue that's not necessary.
Let's talk about that. Why are you eating only the egg whites?
Yeah.
I want you to think about what's your logic? What have you heard? What have you read? And so the only bad thing about yolks is that they have saturated fat and cholesterol in them. So if you're only eating whites, that means that you still believe that eating the yolk is bad for you. Problem is the yolk is that the yolk of an egg is actually a multivitamin, multi-mineral superfood. Yeah. It has a 1-to-1 ratio of protein to fat. Everybody thinks it's all fat, but it's got the same amount of protein as it does fat in just the yolk. All the white is protein. There's none of the vitamins, none of the minerals are in the white. They're all in the yolk. So you're throwing away the best part of the egg.
Right.
That's what you're doing. And I know you're doing that because you thought you watched Dr. Oz or somebody and they said to do that. I used to eat egg white omelets. I am ashamed to admit. Back in the day.
I liked it more than the regular egg. I got accustomed to the taste.
Yeah. And I never liked the egg white. I ain't going to lie. I never liked it. But I ate it because I thought that's what healthy people did.
That's right.
Now I know that's foolishness. And not that you're foolish for doing that. I used to do it too. But now we know better. There's nothing bad for you in an egg yolk. Actually, if I eat 8 or 10 eggs, Dr. Hampton, I'll throw away 4 or 5 of the whites.
That's nice. I haven't done that yet, but I think I may go there. And I'm sure it tastes a little different though, right? When you eat a lot of yolk.
It's much richer. It's much tastier to eat more yolks. And one of the reasons that made me decide that is if I dropped an egg yolk in my dog's bowl, he'll eat that egg yolk up, buddy. He won't even hesitate. But when I gave him a white, he sniffed it and looked at me like, what, are you mad at me? I'm not eating that. And they literally, my dogs won't eat egg whites, but they'll eat the yolk all day long. That's because they got the instinct to know you eat real food and you avoid stuff that's not really that great of a food.
And they didn't listen to an uninformed doctor giving
That's right. And they didn't listen to Dr. Oz.
Right. Now I'm looking at the comments. Keisha, I think Miss Johnson gets it. So she's happy with your feedback. Dr. Hope is one of the doctors. When we do our healthy living event, we teach like 200 or 300 people. Dr. Katina Hope, a Spelman graduate, historically Black school, doing her thing. So shout out to her. We got someone, Karen Murray. She actually said that she thanked both of us. I think she saw our other video, And she said we should think about getting Dr. Brown, the ADA CEO. And you know why? Because she got off of insulin.
Yeah,
right?
yeah, and yeah, Dr. Brown almost got in trouble because she's a diabetic, and she came out and admitted, I eat a low carb diet to control my diabetes.
Yeah.
And I mean, obviously, everybody in the world, like me and Dr. Hampton, we jumped all over that and shared it. There's no telling how many hundreds of thousands of times they got shared.
It was shocking. It was at the end of 2019, I think, but it was like a shocker when we saw that.
Yep. And I just made a YouTube video yesterday talking about the conflict of interest within the American Diabetes Association, of which she's currently the CEO. She immediately started backtracking and stepping away from that and saying, well, I mean, I eat low carb, but I still take my medicine and I still eat my whole wheat. And because the biggest donors to the American Diabetes Association is Eli Lilly and Sanofi, right? And Merck and all these big pharma. And they're the ones that make the insulin. They're the ones that make the pills. They give $1 million a year apiece to the American Diabetes Association. So if she came out and started proclaiming the low carb diet is the way for every diabetic to eat, they would start saying, you know what, I think I'm going to take my $1 million elsewhere. And I'm sure the board of directors had a nice, stern conversation with the doctor and said, hey, shut up about the low carb because that don't help our donations at all.
As with everything, follow the money and you'll understand. And I hope that she overcomes that because eventually the truth has to kind of lift itself up. So, you know, another thing that people have a myth about is that you have to consume your glucose through your diet. And they assume, they say your brain needs sugar, your heart needs sugar, so you have to consume sugar. So I want you to talk a little bit about exogenous sugar or glucose or endogenous. I want to help people understand that you don't have to consume that stuff to get it to your brain.
Yep. Every human body is made of two things, fat and protein. That's what you're made of entirely, plus some minerals, right?
We're not made of starch. We're not made of carbs.
That's right. We're not made of carbs. There is no organ in your body that's made of starch or that's made of potatoes or made of wheat. All those things break down immediately into sugar, and that's the exogenous sugar that Dr. Hampton's talking about. It comes from outside your body through your face hole. That's exogenous sugar. And so I haven't eaten sugar in months. How come I'm not dead? That's because the human liver is very ancient. It's very intelligent. It uses a process called gluconeogenesis. Your liver can instantaneously make all the sugar that your body needs. You eat fat, you eat proteins, your liver can turn that into sugar at a moment's notice if your body needs it. There are certain cells in your body that cannot burn fatty acids or ketones, like your red blood cells. They don't have a nucleus, they don't have mitochondria, they have to have glucose. Your liver makes that glucose. You never need to eat sugar, ever. There are essential amino acids that come from proteins that you have to eat or you will get sick, you'll suffer, and you'll die. There are essential fatty acids that you have to eat in the form of fat or you will get sick, you'll suffer, and you'll die. There is no such thing as an essential sugar. There is no such thing as an essential carbohydrate. There is no such thing.
Wow, that's deep because I grew up, they said you have to have a starch. You have to have all these starchy, carby things. If you didn't have it, you weren't having a meal. And you're saying it's not essential. So, and I remember
the only people that our consuming carbohydrates is essential to is the billion-dollar profits of the big food corporations.
That's
and
right.
The $1 million profits of the huge corporate farming corporations. And the billion-dollar profits for big pharma, the big drug manufacturers. That's who it's essential that we eat lots of carbohydrates for. But if you'd like to have your optimal health, I'd recommend you cut the carbohydrates way, way down.
I remember getting advice that literally as a physician being told, you tell your patients to eat frequent small meals.
Sure.
So you can maintain your blood sugar. That almost sounds like a conspiracy for the food companies.
It really does. And Dr. Fung talks about this so eloquently. He's like, so we're telling people, if you want to lose weight, then eat 6 times a day.
Right.
Right?
Who came up with that, you know?
Wait, what?
I know.
Yeah, and it's just that advice only helps the big food manufacturers and big pharma. That's the only people it helps. Everybody else, it causes chronic diseases, it causes inflammation, and it causes suffering.
Let me ask you one more quick question about food. Not one more, but this really easy one. So I also was taught that nasty, stinky lard that came from, the pigs, that grease from the pig, that's going to clog your arteries. Please explain to this audience why that was a big fat lie.
So human beings have been eating as much animal fat as they can get their grubby hands on since the beginning of time.
That's right.
We have always eaten animal fat, always, always, always. And so when a nutritionist or a dietitian or a doctor, when they come at you and say you should not eat butter or bacon grease, it's bad for you, your question should be based on what? Show me the research. Because when you say that, they're going to start saying because there is no research. This is a theory. This is not even a theory. It's a hypothesis. It's a myth. It's made up horse crap. I'm sorry to be blunt, but that's what it is.
Okay.
There is no research that supports that. So then we got my 3 tests for everything. Does it make common sense? Does avoiding bacon grease make common sense? No. It's delicious. It makes me happy. Is it paleoanthropologically proper? No, we've been eating animal fat ever since we've been on this rock called Earth, right?
Yeah.
Is there any meaningful research to prove it? No. Then all the doctors and dietitians and nutritionists need to shut their mouth about my butter and my bacon grease and my egg yolks. They're wrong.
That's right.
They're wrong. They need to give it up and move on to something else.
And I love all that good stuff. I don't know if you had heard, but I was a vegetarian for 8 years, and it was a painful.
I'm sorry.
And I adapted, I kind of adapted to it eventually, but it was painful. And I was so happy to come back to what is the proper human diet. In fact, and I just want to do an ad for yourself. I know that you asked me to speak at your conference, the Proper Human Diet Conference in September. Could you just give the audience a little bit about what that is so that they'll be able to learn more? Because we're just 2 people, but there's a lot of other folk that's going to be doing it's going to be a virtual conference, right?
Yeah,
so
virtual.
Tell the audience about that a little bit.
So we've got 12 or 13 speakers, and some of these guys are world class, like Dr. Michael Eads, like Professor Tim Noakes. I mean, huge luminaries in the low carb keto community. Multiple other speakers talking about everything. We got Dr. Ben Bickman talking about insulin and insulin resistance. We've got Ask Nurse Cindy. She's going to be talking about how to get over a stall. All these people are going to be talking about different facets of the proper human diet. And so the whole point of this conference is to help you understand each different part of this and be able to put all these parts together so that it makes sense to you. So when you get up out of bed in the morning, it makes sense what you should do, what you should eat, what you should not eat.
That's right.
When you should eat, when you should not eat. And this whole conference, I don't even know how many hours of lecture, and we're going to have buku question and answer sessions with each speaker.
That's right.
And so they'll give their 45-minute presentation. Then there's going to be a 30-minute question and answer. So you can ask your personal question that maybe didn't get covered.
That's right.
And all of that's going to be recorded, and you're going to be able to watch it for a year after that. So if you want to watch it 5, 10, 20 times, you can. And the whole conference is $37.
Sounds like you're not making money on this conference.
All we're trying to do is cover the cost, because like I told you on our podcast we did today,
I love it.
I'm here to help people.
That's
I got to
right.
pay the bills. I got to keep the lights on.
That's right.
But I'm not in this to make $1 million. I'm in this to help 1 million people.
And I love you for that. Denise Smith is one of our phenomenal nurses in my health system. I have not done a lot of research on blood type. I know a lot of people have books about that. I don't know if you have any information about that. Any thoughts on the, eating for your blood type? I know we have tests that can do genetic stuff, but what about the blood type?
Yeah, it's a very compelling hypothesis. You're like, whoa, maybe there's something to that, right? Yeah. And there's actually a book written, gosh, it was probably more than a decade, called The Blood Type Diet.
Right.
I bought it, I read it, I looked up all the references, and I'm like, this is bunk. There's
Right.
nothing
It
genetics.
didn't. It didn't hold up.
No, no, no,
Are you
no.
optimistic? Are you optimistic about? Because I do believe that your genes, your genetic expression is affected by your environment. So, are you optimistic that we will? Are those companies that are doing like 23andMe, or do they have enough information to guide us towards our diet yet, or is it still premature?
It's I think it's permanently premature to think that knowing your DNA will tell you which diet to eat, because we are all human beings. We're the same species, no matter our shape, our size, our color, our flavor. It doesn't matter. We're human beings. We should all eat on the spectrum of the proper human diet. And you actually alluded to this in a talk you were giving the other day. Your DNA does not doom you to having a certain disease. That is not how this works. There's a whole second set of genetics called epigenetics. And your diet, what you eat and what you don't eat, directly affects your epigenetics, which is what decides, am I going to turn on this cancer gene or keep it turned off? Am I going to turn on this obesity gene or keep it turned off? And in a world where we feel like we don't have control over anything, right?
That's right.
You can have control over your diet, and you do get to choose what you put in your face hole and what you don't. And you can have control over your health, both physical and mental.
Love it.
If you eat the right foods.
Gotta eat the right food. A couple of more questions. We're not going to do too many more because we got the whole podcast for people to check out. Most nutrition professionals are trained to say you need to eat a balanced diet. So that would make the assumption that the macronutrient that people choose doesn't matter. You just have to have a balance. So I guess I want to hear your take on, does the macronutrient matter in this ideal of a balanced diet? Is this really something people should worry about?
Yeah, a balanced diet for me means that I eat beef, pork, eggs, bacon, and butter all in the same day. That's a balanced diet for me. The whole concept of a balanced diet was probably thought up by an ad agency. This is a marketing term. It has no basis in science whatsoever. There's no research that shows that you should eat a balance of eat the rainbow, eat a large variety. There's nothing. There's literally you could take a human being and feed them beef, butter, bacon, and eggs for 50 years. And they would not develop a single vitamin or mineral deficiency. They would not develop a deficiency in any phytonutrients, those magical things in plants. They would actually look great, feel great, and perform great. So and here's the second thing. Guess who are the major donors to all the School of Dietetics? Kraft, Kellogg's, Hershey, Cadbury, Heinz. That's where these schools are founded. They get huge donations from the big food companies. So do you think a big food company wants you to eat ancestrally appropriate food that there's a very small profit margin on? Or do they want you to eat stuff made out of grains and out of vegetable oil and out of sugar that they put some food coloring in so it's the rainbow? They make a huge markup on that crap. So they want you to eat that.
Wow.
So these poor dietitians are stuck between a rock and a hard place. They're taught this by their professors who they trust. And then they go out and they start practicing on all their patients, and all their patients keep getting fatter and sicker and more metabolically ill. And they're like, I don't know. I guess these people, I don't know. I guess we're just a sick species. Human beings are very healthy, very lean, very aggressive, very successful species if you feed us properly.
You gotta feed us the right food.
That's right. You can't poison us and expect us to be optimal. That doesn't work that way.
That made me think of one of my last questions for you. Organic, grass-fed, pasture-raised. So a lot of the people we see, you're in a rural community. I'm in an urban community. I have a lot of seniors who have Medicare, got some folk on Medicaid. They call my neighborhood Beverly, but it's not a rich neighborhood, okay? I mean, it's a nice area, but the people who come to my clinic are not Beverly, you know?
Yeah, you live in the other.
Yeah, so if I'm trying to, do keto, carnivore, low carb, if I don't do organic grass-fed, is that going to harm me? What do I do when I don't have I can't go to the Whole Foods because it's killing my pocket? So what would you say?
Yeah. So there's lots of gurus out there who say grass-fed, grass-finished Panda massage meat is good for you, but cheap processed feedlot meat is bad for you. And I completely 100% disagree with that. They are correct that grass-fed, grass-finished, Panda massage, organic, non-GMO meat that's grown on the Himalayan mountains, that is very good for you. There's no doubt about it.
That's right.
But the cheapest bologna and hot dogs and potted meat and Spam that you can get at China Mart, that's what I call our friend we won't name because everything they sell comes from China. The cheapest meat you can buy from a supermarket is not bad for you. It's just a little bit less good, but it's still better, 1,000 times better than the Cheetos, 100 times better than the bread. Eat your meat. Meat is anywhere on the proper human diet spectrum that you want to eat includes meat. Meat is an ancestral food for human beings. We are optimal when we eat meat. Either like me, all I eat is meat. I don't eat anything except meat. Or like Dr. Hampton, you still eat some veg and some fruits, but you still got to have that meat in your diet.
Meat's the main thing.
And so you and I both, we have a patient population who are not in the top 10%. Shall we say that?
Right. That's
they're
fair.
They're in the bottom 80%. Those people can't afford $22 a pound ribeye.
No.
So why would I want to sell that to them?
That's right.
You can do keto just right with hot dogs and mustard. You can do keto just right with bologna and hot sauce, as long as it's low carb.
That's right.
You do not have to eat the expensive grass-finished meat to improve your health. You don't have to do that.
That's right. I'm going to wrap up with a couple of questions in the comments. One is, vitamins and minerals that we are deficient in. So in other words, what things that do we need to add that we may not have in our diets typically?
Yeah. So you mean supplement wise, if you're eating lots of fatty meat and you're including liver in your diet, and it can be cod liver, it can be chicken liver, beef, pork, sheep, goose, it doesn't matter. But if you're eating liver 3 times a week and you're eating lots of fatty meat, and you can add some veg and add some berries, you don't need to take any supplements at all as far as vitamins and minerals. Now, much of the soil that our food grows in and that our cattle graze on is depleted in minerals. And so many of us, everybody eating a standard American diet needs minerals and vitamins. But some of us, even eating keto, carnivore, or low carb, we still need to make sure we're getting plenty of minerals and plenty of electrolytes, right? And that's kind of a global problem, not just a keto problem. But other than that, and then if you're not able to get enough sun, or if you have a very dark skin color, you probably need a vitamin D supplement.
That's right.
Right? Because you gotta get your vitamin D. That's an essential vitamin. And you make it when you're out in the sun. But if you have very dark skin pigment, you don't make it nearly as much.
That's right. I know my lighter skin brothers and sisters, they could probably go out there for 15, 20 minutes and be good. But if you have darker skin like myself or darker, you're going to have to do a little bit better. So I do take a vitamin D supplement every day just to be safe. That's one thing I take. But again, I try to get most of my nutrients from my diet. This question is a little bit more nuanced, but it was a kidney transplant patient. High protein diet causes the BUN to, be a little off. And they were asking, how can I do a low carb diet without hurting my kidney transplant? So, that's kind of the question.
That question is coming from the myth that eating lots of protein is bad for your kidneys. And that's an absolute myth. It's a falsehood. It's a lie. It's never been true, and it's not true now. Your doctor may tell you that, but all anybody's got to do is jump on your internet search engine and type in protein bad for kidneys myth. Just type that in and there are hundreds of articles that doctors have been writing for decades trying to make this myth die and go away, because there's no research to back it up. Even if you've got advanced kidney failure, eating protein is still not bad for your kidneys. The thing you need to avoid like the plague is eating high carbohydrates, because that will destroy your remaining kidney function. Carbohydrates are bad for your kidneys, not protein, and definitely not fat.
Excellent. we're going to wrap it up with that. Any concluding remarks before I kind of give a concluding thought or two?
I just want to thank you for giving me this opportunity to talk to a like-minded doctor. It's good to know that there's other docs out there that have their common sense thinking hat on.
That's right.
Their thinking cap, as my granddaddy used to say, right? Put your thinking cap on, boy, and think about this. And so it's a pleasure chatting with you. I appreciate the opportunity. I just want good health for everybody. I don't want people to limp by and get by and just feel miserable. I want people to feel optimal. I want them to feel great. I want them to wake up every morning ready to attack the day. And you can't do that if you're sick and obese and type 2 diabetic and you got chronic inflammation and chronic pain. So if you'll eat on the spectrum of the proper human diet, whether it's ovo-lacto-pescatarian all the way up to fatty red meat carnivore, you're going to have that energy and you're going to get your inflammation better and you're going to reverse your type 2 diabetes and get rid of your fatty liver and all that other crap that's holding you back.
Thank you very much. I'll say it one more time. You have inspired me. I remember when I asked you a simple question, and I think I asked you, so what's the secret to getting people to follow you? And you said what your wife said, you need to get in front of the camera and just start talking,
That's right.
And that's why I'm so busy. It's easier for me to do what we're doing now. So I won't have to do all that extra stuff. Let's just get in front of the camera, share what we know. Yep. Whoever's going to be blessed will be blessed. Those who are not ready, we'll be here when you're ready.
We'll be back next week for them.
That's right. And I just appreciate, it's almost like going to church. I go to church, I look for 30% who'll listen. I don't go back for the 70%. I go to the next church and get another 30%, and I just keep growing. Eventually, the 70% will get it. And for those who, you can't save everybody, but I just want everybody to know, let's start thinking outside the box. If you're not being successful, everybody, for the most part, 70, 80% of all medical conditions can be reversed, cured, fixed, whatever you want to call it. But you got to give your body the proper nutrient. You got to move your body. And all the stuff I talk about on this nest and this rope, you have to understand what's the root cause of your disease. And of all the things we talk about, the diet is number one. So I want you guys, if you have not heard of Dr. Ken Berry before, go to YouTube, subscribe to his channel. He makes way more videos than me because he just found a way to do it. I'm going to follow in your footsteps in the very near future. Protecting Your Nest podcast. Go and check that out. Everything we talked about today is unlike what we talked about on the episode. So when you listen to the podcast that comes out Friday in a couple of days, you will get some additional talking points that we did not cover. You have an opportunity to change the lives of the people you know and love. Whether it's your colleagues, your friends, family, it doesn't matter. They just need to know this information. So share this video. Follow the other content we're trying to share, and we're going to help you achieve your ideal your ideal state. Dr. Berry said it best. We're trying to optimize your health, and this is how you do it. So I want to thank everybody that's tuned in live. For those who don't tune in live, I'll be happy to, continue to share this message with you as well. So thank you again for your being here, and I look forward to another opportunity. I know we'll be seeing each other at these conferences, so keep doing your work, and I'll keep doing mine. You take care of yourself, buddy.
Thanks, Doc. See you next time.
All right. Take care.